What about staying at home? The benefits of barriers to aging in place. Abstract. Purpose. Aging adults of the community face many challenges related to the daily ability to function as a member of the aging population. Many support services are available to ensure safety and improve the quality of life in the aging adult population. It can be noted that many challenges occur while allowing older adults to age in place. A literature review was conducted to review multiple studies that evaluate the quality of life in the elder population electing to age in place. Methods. Obtain relevant, peer-reviewed articles for assessment regarding the quality of life of the aging population that elect to age in place and assess resources available. This review of literature will give evidence for the benefits and obstacles regarding aging in place. Results. Limited studies are available regarding quality of life, particularly in the minority groups. Quality of life is a personal measurement, and a minimum standard varies from individual to individual. Only a small portion of results assess the quality of life. The definition of quality of life is subjective to the individual, and a minimum standard is identified. Literacy of the aging adult also needs to be taken into consideration. There are many obstacles with aging in place. Such obstacles are the ability to adequately comply with a treatment plan, financial stability, family and community support, and payer information regarding durable medical equipment and home services. It has been proven that older adults remain healthier longer when all obstacles are met, and the elderly can thrive while aging at home. Conclusion. A standardized assessment for quality of life regarding the aging adult aging in place with a minimum value of standards of living needs to be created. At this time, no such assessment tool is developed. This tool also needs to be successful in identifying quality life in minority groups and assessing the quality of life in elders electing to age in place. Members of healthcare teams and the community need to develop multiple disciplinary teams aimed at creating a streamlined process allowing older members of the community to age in place successfully. What is aging in place? Aging in place occurs when an older adult is able to live and age in their residence of choice for as long as possible. Aging in place is defined from the CDC as the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. Stats of aging in place. According to Aging in Place 2019, 9 out of 10 older adults in the United States desire to age in place. Among the age groups within the older population, the 85 to 94-year-olds experienced the fastest growth between 2000 and 2010 via the census, rising from 9.5 million to 12.4 million. The census also gave information in 2010 that there were 40.3 million people aged 65 and older on April 1, 2010, and an increase of 5.3 million since the 2000 census. 11.3 million older adults lived alone during the 2010 census. The number of people 65 and older in the United States is expected to increase to 55 million by 2020. Deciding to age in place. When an older adult decides to age in place, health services, care, support, and resources must be accessible so that their overall health is maintained. The elder is making decisions such as a plan for assistance, a plan for safety, planning for future needs such as transitioning care, financial issues, and other life events that may occur, and in these plans they're also including their spouse and or family in the decision making. Benefits of aging in place. Successful aging includes the ability to maintain dignity and independence. The ability to age in place implies the physical and mental ability to overcome aging-related challenges to maintain dignity, autonomy, and independence. The aging population has a strong sense of attachment and connection to their homes and communities and view this attachment as part of their self-identity. They value aging in place within their community as a crucial component to maintain their independence and enable them to age successfully. Aging in place has been shown to improve clinical outcome of older adults, decreasing their decline in cognitive, continence, depressive symptoms, and their ability to perform activities of daily living. It is a safe choice when compared to outcomes in nursing homes. Benefits continued of aging in place. A benefit is also included in independence. Aging in place increases independence and allows the elder to continue with their everyday routines. It allows freedom to come and leave as they please, which allows them to visit family, friends, and attend events in their community, which increase their quality of life. Another benefit is increasing their cognitive ability. For couples who are aging in place together, it has been found that being a caregiver for someone can help with memory and mental abilities, improving cognitive scores. Studies have shown that the elderly deteriorate with every living environment move, and their cognitive and physical status higher when able to maintain living in the same location. Another benefit is the cost effectiveness. Remaining in your home or community while you age has been shown to increase your quality of life and health, while decreasing the cost of care. The cost of a nursing home can be as high as $5,000 monthly, which is usually paid out of pocket. This cost plus other healthcare costs can be detrimental to the elderly. Safety and health is also another benefit. Aging in place with an adequate support system has been shown to reduce falls, lower the likelihood of hospital admission, and increase patient satisfaction. This type of aging in place has also been shown to decrease hospital readmission. Ward and Rubin of 2018 found that aging in place with the in-home assessments reduces functional decline and mortality rates when compared to aging in a nursing home environment. They also found that these older adults who stayed in their homes were less likely to be readmitted to the hospital and less likely to visit an emergency room. Along with benefits, unfortunately, there are also barriers to aging in place. As our elder population grows, so will the demands for assisted living, skilled nursing facilities, and geriatric services. When choosing to age in place, it is important to address the barriers that may inhibit success with this care plan. Various factors such as decreased activity, safety issues, home maintenance, access to resources, and social support may prevent a patient from being able to stay at home and age in place. Barriers continued. Safety. A home assessment is needed to address concerns of the patient's current living status. While a patient may want to stay at home, the issues of poor lighting, clutter, levels of the home, and access to the home's resources is a major risk factor to be considered. Adults with handicaps or needing the usage of assistive devices might make it increasingly difficult in a home that was not designed to fit these needs. Also, maintenance of the home may become too much for the patient to take care of. These include lawn care, daily cleaning, and preventative care to their residents. Another barrier is lacking resources. Many adults argued home care services at times were deemed unreliable and inconsistent with the continuity of care. Resources can vary from monetary, family, and social support. Among the greatest of concerns is the lack of transportation available to the population, whether it be from family, friends, or unable to use public transport for their needs. So the question is, how can we as nurses help? As healthcare workers, we are trained to promote patients' independence, but are driven by keeping the patient safe. It is our responsibility to provide education to patients and families on both the benefits and challenges aging in place represents. Ways that we can help include providing resources for information, performing assessments, and educating the patient and their family. Some resources and education sites that you can provide for the patient and their family include the National Council of Aging, or the NCA, which provides information regarding community programs and services for ages 60 plus. AARP is a great resource that helps with increased quality of care for ages 50 plus. Programs of All-Inclusive Care for the Elderly, better known as PACE, provides and coordinates senior care living needs. The Elder Care Locator provides resources for financial and legal support. AAA, or Area Agencies of Aging, provides assistance programs for transportation, nutrition, counseling, and caregivers. The National Institution of Aging provides research and information on aging and well-being. Meals on Wheels provides delivery of meals and the resources to those who are in need. Health Finder provides websites with up-to-date health care information, as well as nonprofit organizations that help provide senior care. The National Directory of Home Modifications and Repair Resources is a great list of professionals in the area that are able to help with home renovations. Geriatric assessments. Through functional assessments, an older adult's ability to perform self-care, self-maintenance, and physical activities are identified. In addition, psychological, socioeconomic, and spiritual aspects should be considered. As nurses, some tools that we can use to help assess with ADLs, which would include assessing self-care such as bathing, eating, dressing, communication, toileting, movement, preparing meals, taking medications, home maintenance, and housekeeping, include the CATS Index of ADL, their Barthel Index, and the Lawton IADL scale. Tools that we can use for cognitive assessment that assess language, memory, and attention include the Mini Mental State Exam, or the MMSE, and the Mini COG. For safety, some tools that we can use include the Tahiti Performance, Oriented Mobility Assessment, and the Time Get Up and Go Assessment. In conclusion, as this concept continues to gain popularity, it is important for healthcare professionals to know of available resources to make aging in place a realistic and safe possibility for our elderly population. Thank you for your time and listening to our presentation.